Hi everybody, this is Tom Maxon, LMT from Profound Therapies. I wanted to talk real quick about something that happened yesterday at the chiropractic office. I had a patient come in. He had done a couple therapies already when he came to me, and I tried to get him on my table and tried to have him lay face down on the massage table, and it didn't work at all. He was barely moving, could hardly walk anyway to get over there. And once we got him horizontal on the table, his right shoulder just blew up with pain, like agonizing, literally screaming, yelling, ouch, 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 and like squirming, couldn't handle it for like more than a second. So we got him up slowly and carefully and helped him sit down on like a lower bench behind the table. That was the closest thing that he could sit up on, and then I could access his shoulder and his back a little bit. What had happened is he had gotten hit by a car like a week prior. This was a insurance billing MBA case, as most of our patients there are. And he was in so much pain that if I had done quote unquote deep tissue massage, it would have just sent him through the roof. It would have been horrible if I used deep pressure. And that's what I want to talk about. I really, really don't like that term, deep tissue massage. It's such a misnomer, and it's so common. It's one of the most common terminologies that people know about massage therapy, and they think it's the opposite of relaxation. You're either relaxing frou-frou massage that does nothing except rub lotion on you and put you to sleep, and the opposite of that is deep tissue massage. And whatever that means, it catches all the other definitions of anything therapeutic that you want or need. Any kind of injury rehab, any kind of performance, any kind of sports, any other kind of massage that is meaningful or does something good. The public who don't know, they call it deep tissue massage. And kind of what perpetuates that is also the mistake a lot of the franchise and the big name massage chain clinics make when they hire, is that's the question they ask the therapist. They don't really care about what brand names of training they have and what modalities they know. They'll say, do you do deep tissue? Do you do deep? How deep can you go? And a therapist walking into that hiring process doesn't have a good answer. So they're like, yeah, I do deep. Everything you want, I'll do it. And because that's the language that is being used to them, so they're parroting it back to get the job. And because nobody knows. You don't know what deep is for a client or a patient until they're on the table and you're touching them, until they're in front of you and you can assess what's going on in their body, in their nervous system that day. How are they experiencing the stimuli? How do they experience the world around them? What is catastrophic going on in their body that's ramped up their pain tolerance, or ramped it down, turned it down to nothing when they're in a lot of pain because they have an injury, they have a severe strain or imbalance or something broken perhaps. We're always looking at the imaging, the MRIs and the x-rays in the medical setting to make sure we're not doing any more harm than we're doing good. But in a more typical healthy setting where the clients are coming in as generally fit, healthy, reasonably secure bodies that we can put a little more pressure into, they think they have to have deep pressure too, to prove that they're not just being relaxed and just being put to sleep, because nobody thinks that's good enough. And that's a topic for a whole nother video on another day. But relaxation is super important to your body. Sleep is exceedingly important to your body, and you need to know about that too. Anyway, back to the topic at hand. Deep tissue massage is irrelevant in terms of pressure or depth of technique going into a body if their body is so fired up with inflammation and injury and pain that they can't tolerate it. As soon as a client starts gritting their teeth and holding their breath and fighting back and the muscle spasms up and pushes back against me, I'm doing something wrong. If you feel in your body that you're being attacked by me, I'm not going to get deep. I'm not going to get in there. It's not going to work. So, you need to communicate that and understand that as a client out there, as a therapist talking to the person who's trying to help you. You don't have to come in there with a no pain, no gain mentality. That doesn't work. If you're in pain, your body is going to fight back. If you start poking on a vulnerable, painful spot, it's not going to work. So please talk to your therapist about that. Please have open communication. And that might change day to day, minute to minute. Every time you go in for a massage or some kind of body work treatment, you're probably going to be in a different place. The body changes constantly, all the time. Your nervous system is constantly adapting and changing to deal with the world. There's a lot of stimuli, a lot of stressors out there that are bombarding us all the time. So, try to stay away from the term deep tissue massage and think about the thoroughness of the technique and the knowledge, the academic knowledge, the intuition of the therapist, and how you can take advantage of those skills as much as the brute strength of the therapist. And you're going to have a happier therapist who's not all sore and battered and bruised when they're done with the massage. And the next day, you're going to feel a lot better too. You do not have to be in pain and sore the next day after a massage to have received a fully beneficial treatment. So, thank you for listening to my thoughts, and I will be in touch with you soon.